Hey guys, welcome back to the Balanced Day podcast, where we talk about tech, healthcare, and achieving balance in a modern world. What if your phone could actually help you diagnose cancer in seconds? Well, it can. In this episode, we're going to look at AI's use in UK hospitals and something that is already saving lives. Stay tuned. All right, guys. So, what's happening now in the UK? Really interesting stuff. In the Chelsea and Westminster Hospital in the UK, they've deployed an AI tool and it's called Derm. It's used to analyze skin lesions with just an iPhone and a magnifying lens. So the idea is that clinicians or the dermatologists or somebody, I guess your GP even, could take a photo of a particular lesion. So you've got something on your hand or on your forehead or wherever. You take a picture of it and then you just send it in and have the AI have a look at it. Because at the end of the day, AI, that's what it's great at, right? Looking at finding patterns, seeing what's different and what stands out. So imagine that. You just take a snap of a photo, upload it, and the AI will give you results in seconds. This AI program called Derm apparently boasts a 99.9% accuracy in ruling out melanoma. So melanoma, a very dangerous type of cancer, something that sneaks up on people, but if you leave it too long, it spreads quite rapidly and it can be very dangerous. So it's one of those things that'd be great tool to just be able to, at the very least, try to rule it out. So again, that's not minor. This is something that significantly, I guess, reduces unnecessary specialist referrals. So like, imagine you see something, you're wondering, should I go get, I know in the States, probably even here where I live in Europe, you may not be able to get a dermatologist as quickly as you want, but imagine if you could just take a photo of it, find out, is this something that I need to worry about or not? I mean, I think that would be amazing. So again, one of the big advantages is it helps to triage these cases fast, freeing up the time and energy for complex cases. If AI's flagged it, then you can immediately get into the system, get a biopsy, have somebody look at it. Instead of Googling it and looking at all these things, if you have an integrated AI that would do this, it would be absolutely amazing. So wider adoption. At the moment, it looks like 20 NHS hospitals, so National Health Service in the UK, have already adopted it. It's resulted in apparently 13,000 cancer detections. I guess it was piloted before, but I think it isn't a pilot now. It's actually becoming embedded in routine healthcare. And it reflects how quickly things are going from the experimental phase and straight into actual frontline healthcare. So it's amazing the speed, the rapidity that things are happening now. Okay, so let's look at the benefits and impacts. Like I said earlier, faster diagnosis. Being able to just get a diagnosis or at least rule out something within seconds. Earlier treatment, because when you talk about finding things, especially like cancer, the earlier that you spot these things, then the better the outcomes, the better the prognosis. It reduced bottlenecks in dermatology, right? So a lot of times, when systems are under pressure in hospitals, out in the community, you want to be able to reduce that pressure, reduce the bottlenecks. And sometimes, having access to rapid diagnosis would be huge for that. It empowers general clinicians with tools once reserved for specialists. So the idea is that, it's hard. There's a reason why dermatologists are dermatologists and they make the big bucks, because they specialize in that. If you're looking at slides, you're looking at the lesions, you're looking at skin all the time, then that's going to become your expertise. But now, general clinicians, so your GP, your family doctor, I think it would be really important for them to have these tools, give them more confidence that they're catching these things earlier on, right? And so you don't have to be an absolute specialist to have confidence in your ability to diagnose or at least, like I say, rule out, the really dangerous ones like melanomas, for example. So potential implications, lower costs, fewer unnecessary biopsies. I mean, who wants to have something chopped off when you really didn't need to have it chopped off, right? And improve patient peace of mind, right? You send in the picture to the AI will tell you with a 99.9% accuracy that it's nothing to worry about. It's great peace of mind, right? And at least you're catching things faster. So I guess when you look at the big picture, it's not about replacing doctors, at least not at this point, right? It's about supporting them. In fact, we might reach a stage, probably in the very near future, where all doctors are going to have to use AI of some kind to support them, because why would you not if you have access to such a powerful tool, right? But we are in that transition phase at the moment, so I think it's not about replacing doctors, but it's about supporting them. And then what does this mean for medical training? I guess tech literacy, the new generation of doctors coming in, it's going to be as important as anatomy and physiology, learning about antibiotics, about pathology, learning all the various disease names and things that you learned in medical school. All that stuff was important, but now the idea of learning tech, I think, is going to be another huge implication for the new generation of doctors coming up. This raises ethical, trust questions, but again, the results are promising. We're in this transition phase, so hopefully things will get more accurate, more trustable. Look, and tech that's fast, accurate, and accessible, to me, that's the kind of stuff that we should all be rooting for. We know how expensive healthcare is one of the most expensive things out there. So if we can support in any way to make things more efficient, more accurate, and also more accessible, I think we should all be rooting for that. So to sum up, I think it is a great practical use of AI that's making healthcare better today. And I'd invite all of you, maybe just have a think, like, what do you think? Maybe put that in the comments. What do you think about AI? And I guess the bigger question, would you trust an AI to analyze your skin? Like, would you trust if that was a thing? Leave your comment down below. In the next episode, we're going to look a lot more into diagnostic medicine. Maybe we'll look at some wearables, but I hope to keep you up to speed as much as possible with the latest breaking news, which isn't getting covered in other places. So if you like this kind of content, subscribe, comment, share, and I'll catch you on the next one. Stay balanced.